Ngasi Chief Guest President of the Guest of Honor na dahil selection leader ba itong sila ito'y na ika-observe o yung solicitation kami ng Java kung sige officials na lagyan na magiging hamper doon nila ba actually badal na sige or mo sige Chief Guest ni Pamlangalim Shindiriba Dr. Sapon Rajan Singh Honorable Minister lagyan na magiging hamper doon ng Jerry Tagat Jerry Matanda sige Hormo sige President ni Pamlangalim Shindiriba Sri P.K. Jha Kamasna Kalan Family Welfare Amadi Manipur AIDS Control Society ni President ni Olbiriba Matanda Hobam Rosita IAS Project Director Manipur AIDS Control Society Lingan Amadi Good Hamper Kudol Kandili Tagat Jerry Matanda sige Welcome Address Welcome speech Bibinaba, Ikay Masigi Guest of Honor from Langley Biriba, Ma'am Home Rosita IS Project Director Max Oxygen. A very good morning to everyone. Respected Dr. Sapam Ranjan Singh, Honorable Minister of Health and Family Welfare, Manipur, Sri P.K. Jha, Commissioner Health and Family Welfare, Government of Manipur, and also President Max, officials and staff of Manipur State AIDS Control Society, chief functionaries and staff of our partner TI NGOs, representatives of our bilateral partners, friends from the media, and everyone present here. On this occasion of the observance of the World AIDS Day, which is, we've been observing World AIDS Day every day in a very big manner, but this year, because of the current law and order situation, it's been done in a slightly smaller way. This year, World AIDS Day 2023 will be observed under the theme, Let Communities Lead. The day is observed around the world to show our solidarity and support to the people living with HIV and also to remember those who lost their life to HIV and AIDS. So on this auspicious occasion, first of all, on behalf of Manipur State AIDS Control Society, I extend a warm welcome to Dr. Sapam Ranjan Singh, Honorable Minister of Health and Family Welfare, Manipur, Chief Guest of today's function. Also, I extend a warm welcome to Sir P.K. Jha, Commissioner Health and Family Welfare, Government of Manipur, and President of Max, who is also the President of today's function. I also extend a warm welcome to officials and staff of Manipur State AIDS Control Society, chief functionaries and staff of our partner TI NGOs, friends from the communities, representatives of bilateral partners, friends from the media, and everyone present here. Once again, on behalf of Manipur State AIDS Control Society, I extend a warm welcome to everyone. Thank you, ma'am. Next, we have speech by community representative. I would like to request Srini Khaujam Roshan, Technical Specialist, Adolescent Health, present Accelerate, please.
Good morning. Respected Sir Dr. Sapam Ranjan, Honorable Minister, Health and Family Welfare, Sir P.K. Jha, and Ma'am Rosita. So, on this auspicious occasion of the World AIDS Day, I would like to share some of my experience and on the theme that the community did. So, I myself have been this one of the drug user where I was using drugs when Manipur was at the height of anti-drug movement in the state. So it was during the year 1999, 2000, around those years that I was using drugs, and it was Manipur was at the height of anti-drug movement. So they were like drug users were forced to be incarcerated in some way or another by many vigilante groups, and they were like made to apologize in the media, showing their faces. So various human rights violations have been witnessed when I was using drugs. So, but Manipur has been adapting in such a way that even when we look at the program under the Manipur status policy, Manipur is one of the first state in India where the harm reduction principles were adopted across the country. So Manipur has been showing and leading many ways in terms of innovating service delivery model. So and when I was like using in those days, there were many communities who were delivering services to me. So even though we were hiding from all these vigilante groups and the anti-drug movement, we were like accessing all the separate injecting practices equipments. So it was, I would like to remember those. I was enrolled in one of the targeted interventions under social awareness service organization, and there were two community members that I still remember where they used to come early in the morning riding a ladybird cycle, and they will be like on in front of us every morning waiting for us, trying to get our syringes, needle and syringes delivered. So I'm one of the lucky ones where I can I proudly say that harm reduction actually works because I was using spasmoproximone at that time, and if you look at the injection of spasmoproximone, the half-life of spasmoproximone is very less. So my injecting frequency was very high. So I was like injecting 6 to 7 times or even more when I was using drugs. So exposure to HIV and other bloodborne viruses, I was very, very vulnerable, and many of my friends, they were very vulnerable, meaning I will be requiring more than 10 syringes a day. So besides those, when the community leads and when the service delivery model is led on peer-led model, I was able to be protected from all the bloodborne viruses. Luckily, when I quit drugs and just get myself tested, I was found free of HIV and free of hepatitis B and C as well. So when I was just trying to share some of these experiences so that we can build upon this and also look up towards newer models of innovating service delivery models. So currently, when the world is set to achieve the global goal of ending the HIV/AIDS by 2030, so many of the agencies and stakeholders involved are trying to look at innovating service delivery models so that we could reach the unreached population. So even if you look at the context of Manipur, we are trying to reach the last mile. Manipur being one of the pioneering states implementing harm reduction programs and many of the HIV programs for more than 2 decades. Now it's very high time we look at our policies and programs so that we can adapt to the ever-changing situation at the field. I think the Manipur State AIDS policy was like reviewed during Sir's time when Sir was the project director, but I think it is high time we look back into our state policy once more because I would like to give one more example. If you look at the current TI programs that we are running currently today, it is founded on the service delivery model is founded on hotspot-based delivery. Because if you look back, the classic example is Node AOC. When we look at Node AOC, many people were there congregated at the drug source. So service delivery was very easy at that point of time. We pick a peer from there and services could be delivered. And so there were many hotspots in and around Imphal and across the state. So service delivery model was very easy as compared to today. So even if you look at the current situation in Manipur, the concept of hotspots is no more. So you will find less places where drug users are congregated at a typical point of time. So I think it is high time we look back on our service delivery model at present. So if you look at when I was conducting few of the focus group discussion, currently I'm working on how to design a program for children and adolescents who may exhibit HIV risks. So I was conducting a lot of focus group discussions, and I found that the current modus operandi of scoring drugs is comparatively ever changing. So current nowadays it is based on home deliveries or delivery at a typical point of time. So reaching populations or unreached population becomes the key challenges. So I would like to suggest when we say let the community leads, I think we should need to give a proper space for communities at all levels, including the policy level forums, so that these issues can be discussed and the ever-changing dynamics of the drug user population, be the MSM, the sex workers, the female sex worker rather, or any people, subpopulations which we categorize as high-risk population. So it's high time we give space for all the communities, not in the name. For example, when we talk about involvement or meaningful engagement of people living with HIV/OS, or meaningful engagement of people who use drugs, many a times it is seen that it has been a tokenistic representation. So I believe that if there are more involvement with a proper space, then I believe we could collect a lot of information where we could adapt and address the ever-changing issues that we face today. So thanking you. Thanks.
Next, I request our today's chief guest, Dr. Sapam Ranjan Singh, Honorable Minister, to kindly present speech.
Mayam pumnamakpo kurumzari nasi Manipur State AIDS Control Society na sinbiduna pangtok liba the state level observance of World AIDS Day 2023 under the theme Let Communities Lead. Hagi Tharamjada Prasad the Viriba, Commissioner Health and Family Welfare, Government of Manipur, and also the President of MAX, Sri P.K. Jha, Manipur AIDS Control Society Project Director, Howard Rosita, officials of the Health and Family Welfare Department, MAX, representatives from the NGOs, friends from the media, ladies and gentlemen. Hoi, chahi khuding kidi World AIDS Day zi chawna, on a bigger scale at the Bangpui. But this year, we thought it appropriate that we observe this day, a very important day in the World AIDS Day. Then scale down the Raga, observe those say have a wakalonda. Nasidi, we are in a hall, I should say, otherwise we usually observe this day in a ground or something where all in thousands of people usually congregate. But nevertheless, a very important day. But sorry to say, NGOs yamna nasiji present kya nasing soon away the omale. It would have been very glad, because the lead role it's been played by the NGOs. I am going to be a padada and I can say. A great challenge Manipur in our fight against AIDS, against HIV. It's not over yet. We still have a long way to go. Yes, our fight against AIDS is up. Adult prevalence, though it has come down from 1.99% in 2010 to 0.94 in 2021. But we still have a long way to go. Manipur issues, drugs issues, community representative with a Nambiramba Roshan, Nahibiramba Mayambo. 1990s, I think it started somewhere around 84, 85 and then carried on till 2000. I always say the injectable drugs, from what we saw, it was more of an urban centric but where we have to be very careful as NGOs, community, we have to fight together. Rural belt. It is what we see in the rural belt. lekai drug users ki masing handle a city. It's an experience though data or it has reached the grassroots. Grassroots to the yamna hana uramdaba pot khara ubu phangi. Lekai amada injectable drug users in some leishalakpagi oida, and it spreads. It is such a habit which spreads spread over. I think this is something we all seriously can be raga, and awaba families or drug issues involved taraga. So seasonal example have lots of rehab centers hankura pagi seasonal. So it also shows it's an indication that it has reached uh, the rural belt. Aduna Honorable Chief Minister gave the war against drugs on an aggressive scale without the support of the people, without the support of the community, we will not be able to fight. And I think it's high time. I would say an aggressive approach is very much needed in our fight against HIV and AIDS. As was right said, it's important that we reach the last mile, where it has not reached. We should try and make sure that I had requested the NGOs, next 3-4 months, cha do ai pungzage ai kadai da no cha amwam this thaminaze and I am toina haijabi ai na hamukso adum pamba cannot so some thaminaze, because there are lots of things which we need to learn from the people who are working at the grassroots. I am dealing with Viribanina, but unfortunately cha do invitations. In fact, I had invited. I had invited in the sense cha do I angang ay kenozing ang tahabi mo NGOs kenozing the pamina mo kung katha mali na matanda we plan that every 3-4 months we should at least sit together and then discuss over a cup of tea. Chai pe chai tar. The pamina raga tau say I don't materialize it maybe because of the law and order we handaki thamari mga taruk sa chinabagi walang bayay. I'm sure we can always interact, share our views, share our ideas, and since you all are the people who are there at the grassroots, you all are the people who are interacting with the people living HIV, with the people living with HIV. There are lots of things which I, as a person, if not as a minister, but as a person and I would say as a doctor, would learn a lot from all of you. And for ultimately for the welfare of the people, because we are here for the welfare of the people and to be of good service to the people. And I'm sure we are doing it on a very, very small scale. This would have a meaning, impact with the theme, let the communities lead. As we know, we all are leading from the front, and maybe with this observance of the World AIDS Day 2023, how the communities has been leading from the front. We would work more, and then with the Manipur issues, as I've said, what was the reality, the changing scenario, the shift towards the rural belt. Fight the Honorable Chief Minister, the war against drugs, my partner,
Thank you, sir. Next, I request our today's president, Shri P.K. Jha, IAS Commissioner, Health and Family Welfare, who is also president of MAX. Sir.
On the occasion of World AIDS Day 2023, being observed under the theme of Let Communities Lead, as the president of the AIDS Control Society, I'll again extend a very warm welcome to Chief Guest of today's function, Dr. Sapam Ranjan Singh ji, my colleague in the health department and the project director of the AIDS Control Society, Mrs. H. Rosita, all the senior officials from the health department, AIDS Control Society, my friends from the various partner NGOs, and I repeat, partner is the operative word here. All other guests and dignitaries, and most importantly, the friends from print and electronic media. As we are observing the World AIDS Day today in a very low-key manner this time because of the prevailing situation, it takes me back to 2009. That was the year that I had first taken over as the project director of the State AIDS Control Society, and we had a huge event at First MR ground. And a bit of history for Honorable Minister also. His late father used to be the president of the Legislators Forum, and he also had attended that function. And under his leadership, all the honorable MLAs had come together and they had pledged to donate from their local area development fund some fund for the program related to HIV/AIDS related activities. So, sir, there is a legacy that you have to continue. Today's observance has been rightly been christened under the name of Let Communities Lead. When I said partner NGOs, since beginning it has been understood, unlike any other disease control program, this is one program where maximum work is being done through the NGOs and through the communities. Government is always there, the various agencies are also working, but without the involvement of the community and without the involvement of the NGOs, I do not think that we would have reached where we are today. I still remember looking at the data, and in 1998, among the IDUs, the prevalence rate was 76%. So that was, I'm happy for Roshan that he escaped. But I also interact with so many people from the community, the MNP plus, the CONE, they all keep and meet me for whatever issues, demands, and concerns that they are having. And I also try to learn from their experience. So we had revised the state AIDS policy in 2014-15, if I remember correctly. And any policy is a dynamic document. So the first policy was designed way back in, I believe, early part of 2000, 2005-6. I'm not very sure about the year. And then we revised it after about 8-10 years. So I'm very sure that the time has come for us to again revisit, and the new learnings, the new experiences, and whatever we have learned in last 25-30 years of the AIDS control program, we should now bring them into practice. We should put them in the policy. Needle syringe exchange program is one program where we were pioneers. We showed the way to the country and the world. Similarly, I remember the Project Sunrise. Roshan was involved there as well. That was launched. You were also involved. You were one of the NGOs which were, so Somna will know. And it was launched here. The present BJP party president, Sri JP Nadda ji, he was the Union Health Minister. And at the City Convention Center, Project Sunrise for the northeastern states was launched from Manipur. And again, the beauty of that project was that we had series of discussions. We had at Aizawl, at Shillong. There was also involvement of, what was that agency? That, no, not FHI, that US, that CDC America, CDC, they were also the sponsoring body. And then, sir, the beauty of that project again was that we had series of discussions at various places. The stakeholders were consulted, and I remember having very heated arguments with people. In fact, the country head of CDC America, I had certain issues regarding few proposals, and then we opposed it vehemently, and they were very democratic about it. And with the sum total of all the arguments, discussion, knowledge, and experience that we had, a policy was evolved, and it was launched and implemented. And that is the beauty of this program. 2005, the free ART was rolled out, and that has been a lifesaver. So there's so many initiatives in this field, and the kind of interventions and the quick results that we have seen. So I believe that our NGOs, now it is not a routine job. You are working with people who are high risk groups, the IDUs, the FSWs, the transgenders, the truckers. So yes, the time has come to move away from the concept, not to do away with, but to move away and go beyond the concept of hotspots. The people are coming to the hotspots, but we have to go beyond that also. So that is where the communities have to be involved, communities have to lead, and Manipur has a very strong network of community-based organizations, and they have been taking a lead in various initiatives. And HIV/AIDS is also one of those. We cannot afford to rest easy. Even today, for a state with a very small population like ours, having almost 26, 20,000, 27,000 people reported to be living with HIV/AIDS. These are huge numbers. I would not say, but it's almost approaching 1%. It's not exactly 1%, but then you also have to live with the fact that there could be some cases which have not been reported. So testing, tracking, and putting people on treatment. Then also dealing with issues of co-infections like TB. Then we also have among the IDUs hepatitis B and hepatitis C. So there are so many areas in which, so it's a comprehensive program. So I'm very sure that when we devised NSCP 5, from NSCP 4 to NSCP 5 itself, I was also involved in the formulation of NSCP 4 program by the NACO. NSCP 5, I was not there, though somehow I believe that somehow my involvement with HIV/AIDS is not going to end till the time I am in service. I was here project director twice for 4 years. When I went to Bihar on deputation, there also they made me project director of AIDS Control Society for some time. So one way or the other, I think till the time I am in the service, I will be serving the community, and I'm happy about that. So every program I also request the friends from media. Your messaging, your job is equally important as ours. The way you communicate our message, the way you communicate our ideas to the people in simple language, in simple ways, it will be really important and potent and there is a very beautiful terminology in HIV/AIDS control program, targeted intervention. Yours is going to be one of the most important ways of targeted intervention, targeting the people, targeting the citizenry of the state, and taking our messages across to them. Simple things that you can take to them, which will help them prevent the infection, stay away from infection, and also the awareness, and also fighting the stigma and discrimination related to it. So there are so many issues related to HIV/AIDS, the health part of it, the psychosocial, the social impact, the economic impact, the livelihood opportunities. All these things we have to think about, and we have to constantly engage with each other. So I believe that it was a very apt decision by the decision makers that today it was decided that it will be observed with the theme of Let Communities Lead. And let us pledge our unwavering support and dedication and our unity as we join hands with the communities in the fight against HIV/AIDS. Thank you very much, and Jai Hind.
Thank you, sir. Next, I would like to request Dr. Gayatri Thangjam, Deputy Director, Manipur AIDS Control Society, to kindly present the vote of thanks. A very good morning to all respected dignitaries and everyone present. I, on behalf of the Manipur AIDS Control Society, would like to take this opportunity to express our gratitude to everyone. First and foremost, I would like to thank our esteemed chief guest, Dr. Sapam Ranjan Singh, Honorable Minister, Health and Family Welfare and DIPR, for gracing us with his kind presence and his unwavering support towards this program. I would also like to express our heartiest gratitude to the President of this program, Sri P.K. Jha, Commissioner Health and Family Welfare, Government of Manipur, for his constant guidance. I would also like to thank our Project Director, Dr. Hobam Rosita, for leading us and inspiring us towards the goal of ending AIDS. And I would like to extend our gratitude towards all officials and staffs of the Health Department and MAGS, our partner NGOs, the communities, our friends of the print and electronic media, and everyone present for taking out time and supporting us in making today's program a successful one. Thank you, and together we can fight HIV and STI. Thank you.
With the permission from the chair, I declare World AIDS Day 2023 closed. Nasigi program se link birakiba kwai no thagachari amadi mayam de khair we appreciate. Thank you so much.